Hello, guys, and welcome to the second part in the series of discussions Alan and I from Osteohustle are having, covering questions from students and recent graduates around the UK, all around what they wish they had known during graduation or soon after graduation. And on the second part of the question today, we are asking, what should I expect from a job interview? Now, this is a really common question from students and recent graduates because it is a bit of a minefield out there. There's so much ambiguity. There's not a lot of standardization in the way that principals do interviews in the osteopathic world. So I'm really glad that we have Alan here today to answer these questions for us.
Absolutely. I feel like this is one of the questions that stood out to me because it's one of those unknowns, just like what you said, Dan, is that every principal and every clinic will have a different way of interviewing somebody. But when I was thinking about kind of some of the interviews that I've had and tapping into some of the people that I know who have gone through X amount of associateship interviews and really getting a good idea about what that variation looks like, there are a couple of common factors. And the two really common factors that I found was that the practice will have an idea of what kind of person they're looking for, whether they actually tell you that or not, whether they realize it or not. They will have a general idea of maybe existing people that already work in the practice and they share common personality traits and ways of working. Whereas whether they realize it or not, that they're trying to look for that in you. And so I feel like whether they in terms of what kind of person they're looking for certain traits, right? They're looking for somebody who's caring, professional, a good communicator, or certainly the foundations of wanting to learn to how to be a good communicator, wanting to learn how to develop their clinical rationale and their knowledge, and maybe learn that together as a practice and as a collective. They want someone who's obviously warm and welcoming and friendly, because if you're a little bit closed off, a little bit reserved, and maybe a bit closed doors, then that might not suit the practice. And somebody who is good at timekeeping, because if you turn up late for your interview, that then reflects on what you might be like working at the practice and maybe running over with patients and that kind of thing. So just really keep an eye on how you are at a job interview, being on time, dressing well, communicating, smile, friendly. I always say be nice to the receptionist or be nice to the person who actually greets you to the practice, because they're
Absolutely.
gonna communicate to the practice owner if they're not the one who greets you in the first place. A little tip just outside of this is really pay attention to the phone of how the receptionist actually communicates to patients. That'll give you a good idea on how the practice likes to speak to their patients as well. And so you can obviously weave that into your interview process as well. But the the second thing that I've noticed after speaking to plenty of osteopaths about this is that they will typically ask you three different questions. So they might ask you an examination question. They might say, how would you passively assess the T-spine? Or they'll go, how do you passively assess somebody, or actively assess, or how would you do a standing exam? They might ask you something that really they would expect you to be taught at university. On top of that, they might ask you to perform some treatment, whether that be on the principal themselves or whoever is conducting the interview alongside them. Maybe it's an existing associate, and they might get you to maybe do some treatment on the neck, right? And so they are then expecting you maybe to explain some of your thinking, being like, what kind of structures are you palpating? What are you expecting to feel in somebody who maybe is in the plus 65-year-old category, as opposed to somebody in their 20s. So they might get you to do a little bit of clinical thinking, a little bit of clinical reasoning. And the one that I got asked, which was something that actually threw me off guard, and I'm surprised that I didn't think about it, but it was the question was, what would you do if a patient feels worse after your treatment? So they're getting you to try and think
Mm.
about how you would adapt to a patient who might be a little bit disgruntled, a little bit, pissed off, thinking, oh, I'm back here now and I'm actually feeling worse than when I first came. How are you going to react to that? What are your communication skills, and how would you reset expectations with that patient of what their reaction is like after you've treated them?
And what was your answer?
Oh, bloody hell. Right. Okay.
grilling you now.
I think my answer was something along the lines of trying to explain that treatment rationale is the treatment reaction is very normal. That could be, getting better, getting worse. But I think that if a patient would have come to me and they'd have said that, I would probably do some self-reflecting on being like, how can I improve my communication skills to explain that that is something that is normal, that happens within that first
Mm,
20, 24, 48 hours. But there are plenty of layers to that question. And I just don't want it to be for you what it was to me, which was that it caught me off guard and maybe I did stumble
mm.
so have a think about how you would react and how you would communicate to a patient if things haven't gone to plan.
Yeah, great advice. And I think, yeah, just in summary, in terms of the practicalities of what to expect from a job interview, I think it's always good to assume that you're going to be doing some treatment either on the principal or someone else in the clinic. It's good to assume that they're going to ask you a few clinical questions. And it's always good to assume that, you should be turning up smart, you should be turning up on time, and you want to come off as friendly as possible. And the key things that I found in principals who have hired osteopaths and when I've been interviewing and when I talk to other osteopaths is that yes, they care about your technical skills, but a lot more than that, they care about who you are as a person. Are you good at communicating? Are you a warm person? Are you going to be busy effectively? Because these people are running businesses at the end of the day and they don't want their clinics being quiet. They want their patients to be happy. And if you come across as a happy, warm person, that's often far more important than if your HVT goes through. People always stress out about, will my HVT work on the interview? And, you may do the technique and it doesn't go through and you think, oh my gosh, it's all over. But chances are that's not the main thing they're looking for. If you move and carry yourself with confidence and look like you know what you're doing, that's often far more important.
I feel like, just to add on to that, that they're not expecting you to be the complete package. They're expecting you to be a bit of rough around the edges because you've just qualified from university. So they're not expecting you to be this all-rounder. Oh, they must do perfect C-spine HVTs and they must be perfect to their case history. They're really just looking right, a bit rough around the edges, but good
Mm,
communicator and willing to learn. That's the key thing. And
yeah.
so you might want to weave into the interview that you would love to be able to have the opportunity to continue your learning through shadowing because you understand that
Hmm.
you are maybe a bit rough around the edges. And whilst confidence maybe rise, running high after graduating and all that pressure has come off and I'm an osteopath now, it's important just to show a little bit of humility, sorry. The humidity is getting to me here in Australia. The humility of just being like, I understand I'm not the complete article, but I want to be, but I won't get that if I'm not willing to learn. So communicating that will go a long way in the interview process as well.
Love that. I wish I knew all of this before my first interviews. That's great advice.